helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm your host, Jen Lennon. Today I'm joined by Dr. Eric Arter. He's a chiropractic physician from Thrive Health Systems. Welcome back, Dr. Arter.
Nice to be back, thanks.
Now, Dr. Arter, you always kind of unravel mysteries for us, about how our bodies are working. And one thing we're going to talk about today is the idea of sciatica.
Yes.
And when people say, oh, it's my sciatica acting up, I don't know why I got an old person's accent when I did that, because I can have it too. You have that pain down your leg.
Down the leg.
But really, sciatica is kind of a misnomer. Explain it to us.
Sciatica is a lot like anemia. For example, that's not a diagnosis. It's a symptom of a problem upstream. And so we want to know, yes, the sciatic nerve has pressure on it and you feel pain in the sciatic nerve, but it's coming from somewhere else. And it's often upstream. So the sciatic nerve is made of two nerves coming together, L4 and L5.
Okay, so it's actually happening internally. You said this sciatica is just the symptom of what you're
Yeah.
feeling based on the name of the nerve.
That's right.
So what is happening in there then?
Well, I brought a nice little model here for us
Okay.
today. So these two nerves coming out of the low back, those combine to make a nerve going down the back of the leg. But this is just the sciatic nerve. You could have pain down the leg, numbness, tingling, or weakness, or any of those by themselves. Or you could have that down the front of the leg or down the arm. It really can happen with any nerve.
So what's putting the pressure on that nerve then? What's going on?
Most commonly, it's a disc. And so
Okay.
when a disc, and I've got a little model that I'm going to pull apart here.
Okay,
This is a disc like you would have in your vertebra.
okay.
In between your vertebrae are these little cushions, and if the nucleus, which is this jelly center, is able to break outside of this fibrous outer capsule.
So that's where we see this little intrusion here.
That's right, that's a bulging disc or a herniated disc. Either one can cause the pain, and that ends up pushing out on the nerve.
Onto the nerve.
That's
So when
right.
we've heard of bulging disc or herniated disc,
That's
okay,
right.
makes sense. And I was joking, about older people talking about sciatica, but really, I mean, I'm not kidding. I have felt that at times in my life, and anybody of any age can experience this, correct?
That's right, and it's funny because people often don't know why it came on, where it even started, and it could just because you're really tired at the end of the day, and you reached for your toothbrush and you felt your low back kind of give out,
Okay.
or that pain goes down into the glutes or just into the thigh or down past the knee. You could only feel it in the foot, and a small percentage, about 5.4% of people will feel it in the groin only.
Interesting.
Yeah.
So called sciatica because that, if it's down low, is affecting the sciatic nerve.
That's
But like
right.
you said, it could affect any nerve anywhere along the spine, right?
Yeah.
And
In
then
the
how
neck.
was this traditionally fixed?
So traditionally, I'd say traditionally meaning 20 years ago, this
Okay.
was a surgical operation. You'd be on the table having surgery. That would be the solution. Nowadays, what we're finding out and what the research shows is that surgery and conservative care, 2 years post-op, is about the same in terms of health, prognosis, how well
Interesting.
you're doing. But 20 years down the road, the research is showing us that surgery actually can cause more problems for the discs above and below that area.
So you've spent a great deal of time studying this. I know you
have.
have a lot of expertise in this area. Tell me the treatments that you can offer people.
So a lot of patients will come in and say, well, doc, I've already tried chiropractic care, it didn't work. Well, sometimes chiropractic adjustments are the thing that works, and sometimes it's not. So what we've done is we've incorporated a couple other treatments in our office that allow us to decompress the disc at the same time applying a class 4 laser. This is a unique laser that penetrates very deeply, and it's allowing blood flow to come to the disc when it's rather avascular, meaning there's not a lot of blood flow that comes into this.
Okay. And then this part can pull back in then, is
And
what
that
you're
pulls
saying.
back in. Yeah, we get that nucleus to retract back inside, and then the disc, your body's very intelligent. It sews that up with a little, trying to imagine a stitch that leaves
So-
a little track of nerves.
I know this is very
Yeah.
quick to explain, but I know if you tell people really quickly, they can get a great special
That's
from
right.
you today if they
That's
call.
right. Basically, in my office, about $364 normally.
Okay.
To get a complete evaluation for something like this. If you call in today and mention Moms Every Day that you saw Dr. Arter,
Yep.
$19.
Great.
Yeah.
Excellent. We hope people will get rid of their pain. Thanks,
You
Dr.
bet.
Arter.
Absolutely.
Thanks for joining me today.